Surprise! Where do you guys think I am? Where am I always? At McDonald's. It is my last day of cardiovascular clinicals. Woo! I'm so excited. And I get to leave at 5:30 because so many days I have stayed past the 12-hour shift. And my 12-hour shift actually only gives me 11 and a half hours because I take a half-hour lunch. So I spent a lot of time there. I'm tired, guys. Yesterday, I did a presentation. I have a final. Thank you so much. Have a good day. Caramel iced coffee, $1.35 after tax. Use the app. Add 1 thing of extra cream. Add 1 thing of extra caramel drizzle, maybe 2 if you want it really sweet. And add an extra espresso shot if you need more energy. So good. I heard at one point that cardiovascular has one of the highest turnover rates. It does not surprise me at all. It just isn't a fun unit, guys. It's a lot of sick, old people. I don't know, it's just not a fun unit. People there are worn out, it seems like. Labor and delivery was not as torturous to me because I enjoyed my I had a different preceptor a lot in labor and delivery, but most of them were just fine to work with. And labor and delivery is an interesting floor, even though I would never want to work there. Childbirth is not for me. Medicalized childbirth, I get sometimes we need it. I get sometimes we need C-sections. I'm thankful for them. I'm one of those people that thinks way more interventions are done than is needed, and I don't want to see that constantly. I don't want to deal with it. I've just never been like, oh, childbirth, what a beautiful miracle. I mean, I've been like, oh, what a messy process. And babies come out ugly. So, yeah. But I'd probably rather work in labor and delivery than cardiovascular. I don't know. All the hospital floors I've worked in, if I had to take a hospital job, I don't think hospital nursing's for me. If I had to take a hospital job, I don't know. It's a hard decision between the peds ICU at St. John's, because I'm not driving all the way to St. Louis Children's for work, or our local community hospital med-surg floor, guys. It's a pretty nice place. It's not where you're gonna get all the latest and greatest treatment, but you're gonna get super care there. The nurses care. The nurses treat you like family at our local community hospital. Patient-staff ratio is great. Yeah, it's probably where I'd pick. If I had to work at a hospital, I honestly probably would pick Pana Community Hospital. Probably not where the most money is. Probably Chris will not use this video because it's too dark. I will ramble some more when I get done with my clinicals. Got about a 40-minute drive to finish getting to Springfield. Oh, yeah, can't wait for today to be over. Maybe I can't get put with the same nurse I had last time because she's not working today. I really did enjoy working with her. She had a great way of getting along with the patients. She had a great way of empathizing with them. I don't know, she was great, but she's not working today, so I'll probably be with my normal preceptor, who's a very smart lady, just a different personality than me. That is okay. That is okay. I'm off to clinicals. I'll ramble some more later. All right, guys, I got here. Oh, I'm so tired. A little early. Last day of cardiovascular units. So glad I get done at 5:30 today because I've worked so many extra longer than 12 and a half hour shifts, actually, because to get 12 hours here, I actually had to do 12 and a half hours because we had a half-hour lunch that I did not count for clinicals, except for the one time that we had a product repped during lunch that talked about this like wearable, basically AED device that could shock you if your heart stopped beating while you were home alone. Yeah, that was kind of cool. But so glad, guys. Ooh, I think I'm gonna like Wound Clinic a lot more than this. I was scared of Wound Clinic when I first saw that's where they put me for community health. I almost I mean, I wouldn't say I almost tried to get out of it. I did try to get out of it. I contacted a couple other places trying to get my community health rotation there. And I still am kind of interested in, I'm going to be doing community health when I graduate. Home health is, you know, considered community health. And I still might try to get a few clinical hours in my community health rotation in with whatever nursing agency we go with, if we can get that figured out quickly. But that's whole nother thing. I definitely need to make a post for you guys about what I'm going into when I get out of nursing school, because it is in so many ways very, very different from most of my clinical experiences. And there's so many nurse jobs. I mean, so many different kinds of nurse jobs. A couple of students were able to shadow school nurses, which I don't think they were too happy with that experience, because it's not a lot of hands-on difficult nursing stuff, but it's a nursing job. You need to be a nurse to be a school nurse. You need that degree. And that's an interesting option for nurses, a really interesting work-life balance, or really good work-life balance too. I mean, your kid has a snow day, you have a snow day. Summer's off, you have summers off. Yeah, not a bad gig, really. Anyways, I do need to get my day started so I can get my day ended. I'll be so glad when this rotation is over, guys. I think I'm gonna like Wound Care Clinic. I think some of it's gonna be really to me, but that's okay. I'm so close to done right now, you guys. I have a paper chain at home. It's almost to the spring break loop, which is my last break before the last hurrah. And then I literally think after spring break, I have like 6 or 7 weeks of classes. I don't know exactly how many. You'd think I would know. I know that I have about 57 days left today. I think it's like 6 weeks of classes after spring break. It might be 7. And it'll be a new class, community health. I'll be starting. I don't know how hard or easy that class will be. And then it will be finishing up the rest of my ethics class, which I have a 99.5% or something in. So ethics classes is a very easy class. It's been an easy A. It's been fun though. Like, I've learned a lot and I've enjoyed it. A lot of assignments though, a lot of busy work. I mean, I say busy work because she gives you 100% even, you know, on everything, but still a 5-page paper is a 5-page paper, you know. Yeah, I have to finish ethics class, which that'll be an easy A at the rate it's currently going. I'm going to finish complex health the end of this week. I just have to turn in a PowerPoint thing that I've already done a presentation on, and I have to take a final, and then I'm done. I do need to study for that final. Then I'm done with complex health. Complex health, I probably got a B in. That's my 3rd B in this whole thing. I got B's in both my pathophysiology classes. I'm pretty sure I'll get a B in complex health. Every other class I've gotten an A in. I mean, some degrees are easier than other degrees, but if you're in an ABSN program, my guess is whatever grade you got in college the first time around, you'll probably get similar grades in nursing school. So I feel like, to me, it was a similar amount of work as my human services social work degree. YouTube's made learning different. I say that all the time. YouTube, to me, has totally helped make it easier to learn. Yeah, my last hurrah, community health. I don't know what the assignments are in the community health class because they haven't opened up the class yet, the syllabus. I'm hoping it's easier than complex health, because this is a harder class. And that's it, guys. I'm like, ethics class I'm taking right now is obviously easy and interesting. And then complex health, I'm finishing up, which has been not the easiest class. I'll start community health. It's like a 6-week class, and then I'm done, guys. I go up to Elmhurst for, I think, just a 2-day sim lab. And then I just gotta cram for the NCLEX. And when the NCLEX is, I think it'll take about 30 days for me to get approved to take the NCLEX. I will take the NCLEX as soon as I possibly can. And then after the NCLEX is done, I'll just wait for my license so I can start working, because I'm not at one of those jobs where you can work license pending. Where I'm going right now, St. John's in Springfield for my clinicals, May graduates, people are graduating when I'm graduating, that took jobs is St. John's. They're already working as nurses. They're working as like nurse externs. And I don't know exactly what that means, but I think basically it's like they're a student nurse that's charting in the computer and someone is just overlooking what they're doing and double checking it. But they're giving meds on their own. Like, a nurse isn't in the room with them. Some meds they can't give on their own. Some things they can't do on their own. But they're doing more than techs do. Probably still getting paid what techs are getting paid. But yeah, they can work license pending. They're working right now if they want to. And once they graduate, they will work license pending till they get their license. My job, I can't start till I get my license. So I will have a little bit of downtime. I'm just going to enjoy that downtime. Yeah, I'll enjoy it. Not going to complain for being a little bit, it's not lazy. I'm not even going to say lazy. Enjoying the work-life balance I have not had for the last 20-ish months. Yeah. All right, I got to go in. Can you tell I'm dreading going in? I just keep rambling instead of going in. I need to go in.